Hi everyone and welcome to Alliance Live, the online information and learning portal showcasing examples of innovative and integrated working taking place across Scotland within health and social care. We continue the series of these 30-minute webinars focusing on Discover Digital and how technology can help us manage our well-being, presented by Carmen Paputa Dutu, Development Officer for Digital Health and Care at the Alliance and Project Manager of Discover Digital. Carmen coordinates the communications administration for the Digital Health and Care programme with a focus on public and third sector engagement. She is passionate about employing creative and innovative methods to engage people as well as third sector organisations so they can participate on emerging digital health and care solutions. In 2018, Carmen coordinated the first Discover Digital event series and will be leading on pulling together this current year's programme. Finally, as the panellists deliver presentation, invite the audience to pose questions using the chat box. I'm just going to write a little message in the chat box so you know where it is. So you should see a hi everyone popping up. So please post your questions as the presentation continues, and we'll ask those towards Carmen at the end. That'll make up the Q&A session. So now, without further delay, over to Carmen.
Thank you very much to everyone who's joining us this morning. So as Nick mentioned, I work here in the Alliance Digital Health and Care team. And part of my job role is to pull together the program of events for Discover Digital. But first of all, the context from which this series of events started. And it all pretty much began in 2018 when I was part of the steering group for the Digital Health and Social Care Conference, chaired by Margaret Borisky. That group has representatives from NHS, the Scottish Government, Digital Health and Care and Technology Enabled Care Divisions, and also other groups such as DCS Health and Care Scotland, the DHI, and now CCPS as well. And while we were planning this Digital Health and Social Care Conference, the question that kept popping up was, how do we broaden our engagement around digital meaningfully, and how do we engage a broader audience? How do we bring citizens and just regular people to be involved and to have a voice in these events as well? So basically, from that sort of idea, we thought, well, why don't we create bespoke events for Scotland citizens? So instead of just trying to adapt a conference that's aimed at professionals, why don't we create something especially for them? And that's how Discover Digital came about. Last year was our first edition of this, and we had 5 events in total. We had a pop-up exhibition in Dundee to launch the series of events. We then had another pop-up exhibition in a similar way at the Glasgow Science Centre, and that's where all the images that are on the screen now are from. We also had 3 workshops led by Product Forge, DHI, the Digital Health and Care Institute, and NHS 24, who looked at various themes such as how do we map our health journeys and how can we improve them? How is personal data used in health and social care? And how accessible are our services, and are we including everyone? Our aims through all of these events were to increase awareness of digital for health, allow people to have their say on new initiatives, also allow project leads to hear firsthand what people think and engage in a one-to-one conversation, and to link in with the Digital Health and Social Care Strategy, which was published in April 2018. So as I mentioned before, all of these events were free, and we did try to engage as broad of an audience as possible. The outcomes of the events were that we had quality face-to-face engagement with well over 500 members of the public throughout the week, and online we reached over 1,000. We did try really hard, and we tried different engagement techniques to reach out to grassroots groups. We had personal invitations, and we offered to support people with travel costs and any kind of accessibility needs that they had. And by doing this, we reached audiences that we haven't engaged with before, but we also got really good quality engagement when people did come along to our events. So, for example, at the Glasgow Science Centre event, when we did the survey with all the exhibitors and the collaborators afterwards, some said that throughout the day they engaged with between 60 and 100 people, and some of the conversations that they had were almost such as focus groups. So they got really good feedback on their services, and they got to talk to people of different ages, different backgrounds that they normally or that they wouldn't have otherwise. So that, I believe, that just goes to show how passionate people are about this topic. Once they understand what we're talking about, and once we frame things in a language that's accessible and familiar to them, people really do want to have their say. They want to have a stake at building this future. So having said all this and having given you a bit of an overview of what happened last year, so like I said, we had the one event in Dundee and then 4 events in Glasgow. We are really, really pleased that Discover Digital has grown this year into a much bigger event that covers a better part of Scotland. We are now focusing on the topic of self-management and care, so we're narrowing it down a bit from just general health and well-being. And we now have events planned in Glasgow, Dundee, Aberdeen, Inverness, and Dumfries. This just gives you a bit of an overview of our pop-up exhibitions that we have planned. So these will be similar to the events that happened last year in Dundee and Glasgow, and will now take place at the Aberdeen Science Centre and in Inverness at Eden Court as well. Launching on the 11th of October in Glasgow, so that's the final day of Self-Management Week, and we are working really closely with our colleagues here at the Alliance, working on the program of Self-Management Week. It will then continue in Aberdeen on the 15th of October, Dundee on the 18th of October, and Inverness on the 23rd of October. These events will be similar in the format, and they will all contain family-friendly stalls, talks, and workshops or activities, but they will differ in the range of the collaborators and exhibitors that we have. So while we will have some national organizations coming along to all of these events, the program will also vary according to what's available locally. So for example, in Aberdeen, we will have representatives from Robert Gordon University, Aberdeen City Health and Social Care Partnership, and Aberdeenshire Health and Social Care Partnership, and NHS Grampian. Whereas in Dundee, we'll have organizations local to that area, such as Cargom, for example. The full program for all of these events will be released towards the end of September. We have just launched registrations for all of these events, and they can be accessed on the Alliance website. The link for that will be on my last slide, but we do encourage people to book free tickets before they sell out. In addition to these 4 events, we will also have 2 more Alliance Live webinars, such as this one. So one will be on the 14th of October, which will be Getting to Know About Your Eyes. Chris Grant from AbilityNet will provide a demonstration of some apps that can help those affected by sight loss. And then we'll have Ross McCulloch, Director of Third Sector Lab, on the 22nd of October, talking about digital evolution, not transformation. Details for signing up to these Alliance Live webinars will be made available later in the month. And we will also have some workshops aimed at young people in Dumfries. Again, details will be confirmed very soon, and these are in partnership with NHS 24 and Young Scot. So we really are so pleased that we are now covering more of Scotland. Of course, we would like to cover all of Scotland if possible, and we did have conversations with communities up in the Highlands and Islands as well. And it is our hope that Discover Digital will continue to grow and more organizations and people will get involved as time goes on. So while there is some scope for organizations to get involved at this stage, while some of these events are getting quite full at the moment in terms of others, there are still spaces. So if you are interested, if you have a really innovative project, or even if it's just something that perhaps you might not see as innovative, but the people using your service, it's really transformative for them, then please do get in touch, and we'll try to find a way to raise awareness of what you do or to get involved in some way in one of these events. But really, this is an invitation for people to come along to experience what we will have on offer. And we would like people to come along taking off their professional hats, just come along as citizens and think about, how will this impact your life? How will this make things better for you or for your family? So the first reason to get involved is that all the events are free, accessible, and suitable for all ages and backgrounds. We will once again attempt to reach as wide and varied audience as possible. If you are leading a community group and you think some people might be interested in coming along, please do get in touch. Once again, we can support with accessibility, or we can cover transport for certain groups. We do want to hear from people that wouldn't normally or otherwise be involved in such opportunities. So come along or get in touch if you think we can help other people come along. The second reason is that together we can harness the power of digital to look after our well-being on our own terms. We really need to ensure that new technology and digital innovations are developed not just with people in mind, but with people around the decision-making table. It's something that concerns us all, so we should all be involved. And we can only do this if we become more aware of what's out there, if we try to link up, to make connections, to collaborate, and to bring it all together in a way that makes sense for us, and as I said before, for our families and for those we work with. So these events are also meant to be sort of a gathering ground for people to not just come and learn more, but also to see if there's any connections that they can make, or if there's any duplication that can be avoided by better working together in the future. And it's something that we've heard from our events last year. Not only did our citizens, our general public visitors say that they got a lot out of it, but also the exhibitors made connections that they wouldn't have otherwise, because we had representatives from private sector, public sector, third sector, academia. So it's always really good to just get together and have these conversations and be more aware of what's available out there. And then the third reason to get involved, and that's really at the core of Discover Digital, is that we are exploring and talking about digital, but what we are discovering are communities, and that's really at the heart of what we're trying to do. And something I found out by leading on this initiative and traveling and trying to raise awareness and get people involved, that it's never about the technology. It's all about people working together, people trying to help and trying to figure out what works best for them and how they can still be connected, still preserve human touch points, and know where to go and where they can find help. Technology and digital are all good, but they're simply enablers for all of this to happen. They will never, ever replace human contact. And it's not our vision that that should happen. I don't think anyone else wants for that to happen. It's all about finding ways of working better together, being more efficient, and supporting those who need it most. So having said that, here is the link. So it's www.alliance-scotland.org.uk/discover digital. By following this link, you'll be able to see Eventbrite links for the events that we already have live, so where you can already book tickets. These are the Glasgow, Aberdeen, Dundee and Inverness events. You will have to choose your arrival time. That's simply for us to better manage flow and to offer as many people as possible the chance to come along and engage with our various exhibitors and experts in all the locations. As I said before, this is mainly an invitation for people to come along and experience what you have on offer. Of course, if you're a professional and you would like to learn more about it, you are more than welcome to come. This is free and open to everyone. I think my one request would be, if you are coming in a professional capacity, maybe try and bring someone along with you who wouldn't normally come to this, whether it's a sibling, a family member, a neighbor, just anyone. Try to think of someone who could benefit from understanding more about technology and digital and how our future can be better if we all work together. And I think that concludes my presentation. If there are any questions, I would be more than happy to take them. So I'll hand back to Nick.
Yep, thanks very much, Carmen, for that fantastic presentation. That does bring us to the end of the presentation section and on to the Q&A portion of the webinar. We've got 4 questions here so far, but feel free to continue to post your questions as we read through these. So the first one is an external question that we got from Twitter, and it's what have been the key learning that you have gained from these events about the role digital has to play in health and social care?
I think the key learning we got from various participants at the workshops last year was that it very much differs. So there is, and I know we talk about this time and time again, there is no one size fits all. When we're trying to create a digital pathway, it's very important to consider the person that we're creating for specifically. And it's not just about, I suppose, their age or their digital skills. It's more than that. It's also looking at any cultural background, whether they have any family that, it's quite often we just think that people always have family available to help them, but it's not always the case. So it very much depends, and there's a lot of work, but it is much easier to do this work if we have conversations with the people we are trying to help.
That's great. The second one is also from Twitter. How can digital further the benefits that self-management has to offer?
I think, and that's really something that we want to explore this year. So we want to hear from people, what are their thoughts on how digital can help. I think it can help people by giving them more tools. Self-management is all about having the right tools at the right time that work for you. And a lot of long-term conditions change a lot over time. So the support that you need can change from month to month or from year to year. And digital offers the flexibility to enable people to trial different things, experiment, and find the right tools for them at the right time. Of course, all of this should be done with proper support and with their support networks and health professionals involved. But I think it's all about that flexibility and about the right help at the right time being available.
And our third question that also came from Twitter: how will these events feed into the larger conversation about digital's role in health?
So similar to last year, we will use all the findings and all the outcomes and the insights that we will gather from citizens at these events to compile our report, but more than just a report. So we will present all of these at this year's edition of the Digital Health and Social Care Conference, which is now called Digital Health and Care Fest. So we will take these forward and we'll present them in front of an audience of policymakers and project leaders, which can also, which can take this forward. But we also want to continue this engagement, whereas last year we had Discover Digital and then people weren't quite sure what to do after. We didn't have a very clear call to action. That was one of the main learning points. So we want to make sure that we have continued engagement with people that doesn't stop at the end of October when Discover Digital ends, so that we can continuously engage citizens and offer them a real platform to voice their opinions and views on how technology should advance in the future.
Great. And our last question comes from Matthew, who asks, how can third sector organisations get involved in Discover Digital?
So as I mentioned before, just feel free to drop me an email. My email address is on the Alliance website. We are very keen to showcase innovation from the third sector through our events, and we know that there is so much creativity and wonderful work being produced. So if you just drop me an email and if you would tell me, which of the events you would like to get involved, I'd be more than happy to let you know what kind of space we have available. Or if we don't have spaces for stands, we can always provide an opportunity for you to give a talk or run an activity with visitors at the Discover Digital event.
And we've just had a question come in from Kirsty Goodfellow. Do you have any advice on the best way to start collaboration when starting a digital project?
Again, it might sound like something very simple, and I'm not an expert in this, but I think talking to other people, trying to first find out what's already being done and trying not to duplicate any work. Collaboration really is key, especially in something like digital, where technology just advances so fast that it's so easy to start something and then by the end of your project it's already been done elsewhere or it's obsolete. So just talking to people and trying to build everything on the foundations of strong collaborations rather than trying to do things in isolation. Of course, I appreciate that's not always easy, and that's also something that we in the digital health and care team can support with. So if organizations have ideas for new projects, we welcome people to just get in touch with us, and we're happy to have a conversation and see if we can link you in with anyone else or signpost to sources and funding available at the moment, or just try and help the best we can.
Great. And Lynn Anderson asked question, digital and older people, a natural partnership?
So that's interesting, and that's something that we explored last year, especially through the NHS 24 event. I think there are a lot of preconceptions around older people and their use of technology. On the one side, people think that they might find it more difficult. On the other side, there's the whole silver surfer idea. And again, I think the truth is somewhere in the middle. It depends from person to person. And from what I've seen, older people are very keen to engage as long as they are supported and as long as they know who to ask for help and that they're not alone in this. The idea of, family members helping them was also raised by a group of older people at one of our workshops. And again, that's something that can be really powerful. So just having intergenerational help, even if it's not members of their family, but there have been projects in Scotland where younger groups of people have helped the elderly just engage with technology and use it for their health, but also to tackle social isolation and things like that. And it's been really successful. So I think as long as it's done right and as long as people are being involved in the conversations happening at the beginning with regards to how they would like to be engaged and what matters to them and what they want to get out of the technology. It's not always just about, I suppose, self-managing a medical condition, or that's in the background. It's more about keeping in touch, being involved, just being in control of your own situation. I hope that sort of answers the question, but it's a very interesting topic that we'll continue to explore.
That's a great answer. That brings us to the end of our webinar. That's all the questions finished. Thank you, Carmen, for delivering the fantastic presentation and answering those questions. We hope it has provided some insight and takeaways to bring to everyone's own organisations. Before we go, we'd also like to draw your attention to some of the other new pieces of work taking place at the Alliance. First, we have the integration stories, sharing innovation and best practice and integration across Scotland, and also the integration network, which is free to join for anyone who's interested in sharing best practice, learning and helping to shape integration throughout Scotland. If anyone's interested in getting involved with any of those topics, then please do get in touch using the contact options in front of you. Finally, a big thank you to everyone again who registered for this webinar. We hope to have you to join for our next one on the 24th of September with Andrew Moore, Head of Excellence in Care at the NHS, who will be presenting on the new nursing standards that are being developed. More information will be available on that in the coming days. Thanks again and hope to see you soon.
Thank you very much.